Flu season officially is September 1st through April 30th, but like we know last season, it went all the way into June. So it can extend past those dates. And symptoms of the flu: fever, sore throat, runny nose, muscle aches, fatigue, any one of those symptoms, combination of those symptoms. If you have the flu, if signs and symptoms are ignored, it can definitely go into more complicated conditions such as bacterial pneumonia, ear infections. It can make any other health condition worsen if you do not take care of yourself when you have the flu. So your best protection against the flu is to receive the flu vaccine, and of course to practice good infection prevention practices, very good hand hygiene, cough etiquette, make sure you have lots of tissues nearby, drink a lot of fluids, and rest. Here at Good Samaritan, we have now 2 new flu vaccines this season. For our patients and employees 65 and over, we have the Flu Zone High Dose, and that's for our, like I said, patients 65 and over, because as we get older, our immune system is not as responsive, so we want to give you that extra added boost. So that's why we're offering the high dose for our 65 and over patients and employees. And for all our other patients and employees, it would be the quadrivalent. The quadrivalent covers 2 influenza A viruses and 2 influenza B, as opposed to last year we had the trivalent that only covered 2 A's and 1 B. So a person can spread the virus actually 1 or 2 days prior to actually showing symptoms, and then 5 to 7 days after the start of the illness. And young children and people with a weakened immune system could actually maybe spread it even longer than that. All our entrances, we do have signs to remind people to protect themselves by using good cough etiquette. We do have hand sanitizers at our elevators. And in our emergency room, any patient that comes in with a cough or fever, they will be given a mask, and then they will be evaluated. And we do have isolation rooms. They will be placed on droplet precautions until proven that it's not the flu and they're not at risk for spreading the virus to other patients and employees. You cannot get the flu from the flu shot. You may have some symptoms from the flu shot, but it's just your body's response to the flu vaccine, and you're building up an immunity. The flu vaccine is not 100% protection against the flu, but if you do get exposed to it and come down with the flu, your symptoms will be a lot less. You will not be as sick as somebody who did not take the flu vaccine. Here at Good Samaritan, our staff are educated on very good hand hygiene before and after every single patient care. We practice cough etiquette. We don't encourage our employees to come to work if they have any signs and symptoms of the flu. And as for our visitors, we educate them as well on the importance of hand hygiene. And if they're ill, we don't recommend that they come and visit their loved ones.